When Drew Atkins makes his periodic visits to the North Hollywood Health Center, he thinks about his husband, who passed away after battling AIDS.
I watched him deteriorate, waste, and just become less and less and less. And it is traumatizing and it is agonizing.
The experience was horrifying, but a wake-up call for Atkins to take charge of his sexual health.
Obviously, I've managed to dodge the infection, but it affects your personal life and it affects intimacy.
Some friends recommended he try a drug called PrEP, which stands for pre-exposure prophylaxis. It's a medication taken once a day to prevent HIV.
I'm human. There are going to be incidents where it is not as safe. And with the advent of PrEP, this has been an absolute godsend for generations of gay men who have learned not to trust each other.
PrEP is a blue pill about the size of a multivitamin that's taken once daily at the same time daily. The way that it works is that it builds up in the body and protects the cells from HIV attaching to the cell.
But PrEP is not cheap. If you have insurance, you can expect to pay a normal copay. Without insurance, though, out-of-pocket costs can be as high as $13,000 per year. That's where the Department of Public Health got involved. At any county clinic, patients at high risk for HIV can receive a free 30-day prescription of this potentially life-saving blue pill. When used correctly, it can reduce your risk of HIV by more than 90%. There are three primary groups that are at high risk of contracting HIV: Black and Latino men who have sex with men, transgender women, and African American heterosexual women. Just in LA County alone, 55,000 gay men are at risk of contracting HIV.
PrEP is not very well known among the communities that are most affected by HIV. It was approved by the FDA in 2012, and there's been very slow uptake of PrEP in LA County. For those reasons, we expanded PrEP into our STD clinics. We began providing those services, as well as partnering with clinics across LA County called the PrEP Centers of Excellence that will also be doing PrEP for patients at low or no cost.
Now, when patients enter the county clinic, roughly 30% of them request PrEP, and the medical professionals recommend PrEP to 40% of the other visiting patients. As for empowering communities at risk, well, that's a daily prescription for everyone at this county clinic.
I absolutely feel very blessed that I live in a county that is supporting this program.
Reporting in North Hollywood, I'm Jackie Karsh.